Assalamualaikum warahmatullahi Assalamualaikum warahmatullahi wabarakatuh. Hi everyone, welcome to our presentation with group number 1. We're going to presentation about stressor, coping mechanism, and motivation among healthcare workers in dealing with stress due to the COVID-19 pandemic in Indonesia. But first, let me introduce our member. My name is Ica Emilia, and then second, Dian Febriyanti. Number 3, Intan Rahmalailatul Asiyah. Number 4, Lailatul Karomah. Number 5, Vanisha Amanda. And number 6, Riza Asmaul Husnah. Okay, next.
Okay, the first is the connecting part. Um, Here we find a journal which we think has a correlation with the reading text given by Miss Vitti. And the title is Factor Causing Stress in Health and Community when the COVID-19 Pandemic. Various psychological disorders have been reported and published during the COVID-19 outbreak, one of which is stress. Stress is not only felt by the community, even health workers and everyone who works in the medical field. Physiological disorders have a wider and longer lasting impact compared to physical injuries, while the attention to mental health is far less. Causes of stress in health are at high risk of experiencing mental problems in the form of mild to severe stress due to the increased stressing they have to face. Fear, in particular, at the increased risk of being exposed, infected, and possibly infecting their loved ones is also a burden. Many health workers have to isolate themselves from from their family and closest people even though they do not experience COVID-19. This is a difficult decision and can cause significant physiological disorders on them. Okay, next slide.
Okay, I will continue. Effort that can be made to reduce pressure on health worker, the psychological crisis on health worker caused by the COVID-19 pandemic is expected to trigger an urgent need to design and implement psychosocial support and program intervention to reduce psychological stress. In the event of health crisis and change in the work pressure, trauma healing programs, hypnotherapy, and mentoring of psychiatrists who routinely provide psychological refresh for her workers should be considered strategies other than curative strategies that focus on psycho psy- psycho healing of patients. Sourced by Rina Trihandayani, Saras Kuntari, Akhwar Tuti, Tri Darmayanti, Aris Widianto, Joko Triatmojo, 2020 Factors Causing Stress in Health and Community when the COVID-19 Pandemic with a journal, Mental Nursing Journal. Okay, next.
Sorry, beforehand for not turning off the camera due to network constraints. Okay, the second passage speaker. First, paragraph 3, sentence 1. As the sentence states, my reason, because in my opinion, in that sentence does health professionally appreciate their job with their enthusiasm and responsibility so that they can help the country, of course, for COVID-19 patients to rise up in recovery. Next, the second paragraph for sentence 1. My reason in this sentence for me a reader is it is very interesting because it is help workers in times of a pandemic like this who are betting their lives on themselves by attaching importance to other people's circumstances. The last, the third, paragraph 5, sentence 4. As the sentence states, my reason, in this sentence, reader find it very sad for hard works who are determined to risk their lives for the safety of my many people. With, they, with that they are willing to stay away from their families. And of course, the family of health, health works will be worried about his condition. What is what is the power of the family? We can only pray for his safety. Next slide.
Okay. The third summaries. Next slide. There are 220 health workers who were working in community health center, hospital, and volunteers during the COVID-19 pandemic, so that the average age was 33 years with average work experience of 10 years. The majority of health workers are women, 74.9%. The three coping strategies most commonly used by health workers to deal with the COVID-19 outbreak were adopting a positive attitude to motivate themselves. 98.3% reading about COVID-19 and its prevention and transmission. 98.3% and following appropriate self-protection measure marks gown. 98.3% family support was a significant factor motivating health workers to deal with the COVID-19 outbreak. 98.7%. Next slide. Health workers have an obligation to provide health service during the COVID-19 pandemic. So they are required to use PPE every day as the best protection of healthcare workers. However, using PPE every day causes discomfort, so it becomes a stressor for health workers. Discomfort from using PPE includes at first skin reaction, respiratory difficulty, heat stress, dizziness, and noise. Family support is the main factor that motivates healthcare workers to provide healthcare service during the COVID-19 outbreak. So it is important to provide opportunities for health workers to make contact and gather with families to provide mutual support. If it is impossible to meet family members, the each family member needs to communicate regularly by sending positive messages and motivating health workers to deal with the COVID-19 outbreak. Okay, next slide.
Okay, next is the word wizard where there are 15 interesting words or what we do not understand, namely. One, stressor. Stressor translate from English. Stressor are chemical or biological substance, environmental condition, external stimuli or even that cause stress on an organism. Psychological speaking, stressor can be even or environment that can be perceived as demanding, challenging, and or threatening an individual safety. Two, coping. Coping is a content, cognitive, and behavioral change in a effort to cope with specific internal and or external demand that exhaust or exceed individual source. Three, a pandemic. A pandemic is an epidemic of a disease that spread over a large area, for example, several continents or around the world. For descriptive analysis. Descriptive analysis is a part of statistics used to describe data without intending to analyze or make conclusion, but only to explain group of data. 5. Volunteers. Volunteers are people who volunteer to help in certain service or organization without wanting or involving more money in return for their work. 6. Majority. Majority is the large number of people who show certain characteristics according to a standard compared to the others number who do not show that character. 7. Respondent. Respondent are people who respond the question raised by the person who has the direct interview or the person who fills in the questionnaire given by the person making the questionnaire. 8. Significant. Significant is something or someone that is considered important or significant because it can have an influence or impact and cannot be spared from a problem. 9. PPE. PPE is equipment that must be used when working according to work hazard areas to maintain the safety of the worker in himself and those around him. 10. An outbreak. An outbreak is a clear, albeit small, increase in the number of cases when compared to the anticipated normal number. 11. The front line or figures. The front line or figures in a person who is always in the forefront, who is commonly referred to as a hero. 12. Detection. Detection is a process to check or carry out a examination of something by using certain method and technique. 13. Contact. Contact is a relationship with one another. 15. 14. Collaboration. Collaboration is a skill that allow a person to work together with others. Next.
Well, then I will explain about the discussion director section, which is related to question that I will ask other groups. Next. 1. What are the stressors for health workers when dealing with COVID-19 patients? 2. What is the coping mechanism for health workers who experience stress? 3. How do health workers protect themselves from COVID-19 while carrying out their duties to care for patients? 4. What is the opinion of the group about health workers who deal with COVID-19 being shunned and ostracized by the community? 5. What factors motivated health workers to provide health services during the COVID-19 virus outbreak? Next.
Okay, so thank you so much for watching this video. I know this is not that perfect, but we're trying with our best. So at the end, wassalamualaikum warahmatullahi wabarakatuh.